Hi, I'm Rhonda Tomasi, President of International Upper Cervical Patient Advocates Association. I'd like to invite you to consider joining us in our efforts to take the message of upper cervical care to the world. Greg Buchanan of UPCspine.com from Australia, James, my husband and author of What Time Tuesday, and myself formed the Advocates Association in January of 2007. And today we have many members, and part of what we do is enable patients to become active advocates in their community, thus reaching people that the three of us will never be able to reach. And let me show you some of the materials we use. First, we give you a static sticker that goes on the back of your car. Its paint is black and white, but it has our 800 number, and people can call in and find out what the sticker's about from that. Then we give you some of Greg's cards, and we ask you to post your personal story on his website so that we can link from it from our website, uppercervicaladvocates.com. And his address is upcspine.com. So if you have not posted your story yet, please go there today and tell us what happened with you. Next, we give you a flip fold card. This is designed for you to meet with strangers in Walmart, a restaurant, your church, people that you don't know really well. But you notice maybe they have a problem. On the front it says, hopeless, pain, desperate. We have an answer. On the back, it talks about upper cervical care and gives our website. When they flip it open, they will see different conditions that affect people. For example, for women, it may be depression, TMJ, menopause, fibromyalgia, infertility, irritable bowel syndrome, migraine headaches, arthritis, diabetes, or even TN, trigeminal neuralgia, which is what James had. For men, it lists Parkinson's disease, restless leg syndrome, dizziness and vertigo, herniated disc, high blood pressure, Meniere's disease, sciatica or back pain, neuralgias and neuritis, ringing in the ear, and tendinitis. But we don't stop there. There's another market we want to reach. We don't want to see children grow up and develop the symptoms and the problems that we as adults encounter during our lifetime. So we've listed a segment for children: ADHD, AD, autism, bedwetting, ear infections, epileptic seizures, eye and ear infections, hyperactivity, learning disorders, colic, asthma, and allergies. And are these authentic? You bet. James and I have traveled the world over the last 11 years, and we've talked with people that have found their answer for these conditions under upper cervical care. So when we list them on this card, it's not just to get your attention. It's because we personally know someone that this was their answer. And inside is your doctor's personal business card so that that individual can find him. Now, let's say you're traveling like we do a lot and you're at a rest stop on an interstate, which I have found people that get out of a car with a cane or a walker, try to go to the restroom, and so I hand them a little card, but inside I give them my business card, or on the back we have our websites, including Greg's, which has Locate a Doctor in the country, which we're in North America now, that they can locate a doctor in. So if you're not close enough for them to come to your personal upper cervical doctor, they can find another avenue. You receive a membership card, and the membership card has a specific purpose. We want to invite you to the upper cervical evolutions, which are held annually. Hundreds of upper cervical doctors and students attend the evolutions to be inspired, to learn more about the chiropractic upper cervical philosophy that the upper cervical doctors have. And we want you to come as a patient advocate. We want to see 1,000 members at the next one, because there we can join together with these doctors and learn how to better promote upper cervical care in local communities, regional communities, and eventually in the world. For instance, did you know that upper cervical offices are now opening in Italy? We have some scheduled in Greece and in Spain, in Honduras. This news is going worldwide. The upper cervical centers being sponsored in Italy are actually being sponsored by a hospital, and they've taken the name Upper Cervical Health Centers of America and plugged it in so that they can personally refer patients. After 15 successful cases coming into the U.S. for 90 days, they're convinced upper cervical care can do things for their patients that traditional medicine operations, organ removal, and medications have not done. It's just a beginning. We provide you in the packet postcards in 2 different sizes. The purpose of the postcard is so that you can reach people that you read about in your local newspaper. Maybe they had a car accident. Maybe they're in a wheelchair from an accident or a fall. Maybe they have a debilitating disease like lupus, and they're looking for an answer, and possibly upper cervical care may be that answer. What I do, I clip the article out of the newspaper, or I go to the website and I try to Google an address or a phone number. We've seen football injuries, and I will find the address and mail one of our What Time Tuesday books along with some of the cards, informational cards on upper cervical, to those people. Why? Because we want to see them be reached. We want to see them find their answer. It took us 12 years to find an answer for my husband's trigeminal neuralgia. 12 years of suffering and getting to the place that he was going to commit suicide. We're passionate about what we do because we don't want to see you suffer or those you come in contact with as upper cervical advocates. We also give you in your packet a paper on retracing so you know what to expect after you've received and benefited from upper cervical care as your body begins to go through various changes. And then we give you a little letter and a monthly newsletter. And in the monthly newsletter, we describe or recommend things that you can do as a patient advocate in your local community. Now let's talk about some other things that you can do. For instance, we need people who are interested in being speakers on a local level, on a regional and national level. We need people that are passionate about the health and healing they received under upper cervical care. People that aren't afraid to stand up and publicly tell their experience. We need you in the local fibromyalgia support groups, Meniere's groups, autistic groups, in the local civic organizations, Lions Club, the Rotary Club, other civic organizations where there's an audience that has not been reached yet. And your doctor will supply you with the What Time Tuesday books that you can give away free when you go to a networking club or to any club, civic organization. We need people that are willing to get out there. You can be simple and hand out the materials, or you can be trained as a speaker. If you sign up as an advocate member through your local doctor's office and then attend the evolution, we want to train you as a speaker, begin to put you on the Upper Cervical Advocates website as a speaker, and send you out as a national organization. Your expenses will be covered and you'll be given a nominal speaker's fee. But we need you. We need you to be willing to speak out just like we have, because the 3 of us can't do it by ourselves. And we want to reach the world. Thank you for considering becoming an upper cervical advocate at Upper Cervical Patients or uppercervicaladvocates.com. Thank you.